Hi, my name is Liane Jollon. I'm the Director of San Juan Basin Public Health here in Southwest Colorado, serving Archuleta and La Plata counties. It's January 29th, and we're here with our weekly COVID update. Today, Governor Polis announced changes to Colorado's phased distribution plan. We want everyone to really understand that these changes are dependent on each county's vaccine availability, and each county's vaccine availability is dependent on the state's vaccine availability. So both the local communities and the state are working to learn what vaccine will be distributed across the country, and at the same time build capacity to implement these changes. So with that, we will have more information to share about these changes in the next few days. But right now, we can share what was announced by the governor just a few hours ago. So currently, Colorado is in phase 1B. Phase 1B will now be known as phase 1B1. This is where we are right now. This phase includes Coloradans who are 70 and older. And as we've talked about before, Coloradans who are 70 and older have been assigned by the state to be largely carried out by hospitals and safety net healthcare providers. We have also seen some community efforts to augment our 70-plus-year-olds, and that is all happening now in our community. The other part of phase 1B1 are our moderate risk healthcare workers and our first responders. San Juan Basin Public Health has worked with community partners, including pharmacies, to ensure that vaccine has been made available to our moderate risk healthcare workers and our first responders. As of today, the next phase in 1B is now called 1B2, and Colorado has an expectation to open 1B2 on February 8th. 1B2 now includes Coloradans ages 65 to 69, as well as all of our educators. This is everyone from pre-K to 12th grade, working in schools and working in licensed child care programs so that our children can be safe in in-person learning. So again, the goal here is February 8th for these groups, but we do have to say this is dependent on vaccine being distributed across the state for all of these groups. The next thing that Colorado announced is phase 1B3. This group is slated to start March 5th, and this includes large groups of frontline essential workers, all of the workers who have been keeping us able to live our lives and function since the beginning of this pandemic will be in the essential worker group beginning March 5th. The other group that's opening up March 5th are Coloradans age 16 to 64 with 2 or more high-risk conditions. Again, these dates, February 8th and March 5th, are absolutely dependent on vaccine being available, but they were announced by the governor today. At San Juan Basin Public Health, we are so looking forward to all of this vaccine being available in our community and working with community partners to get the vaccine out. There's a couple of things we want to remind you of. Now that vaccine is available to general population, and right now the general population or general population over 70 years old, we've heard that some individuals are coming in for one shot and not coming back in for their second dose. We really want to remind people that 2 doses are what gets you the protection that you need from COVID-19, and we encourage you to absolutely leave your first appointment with your second appointment set up. If by some chance you miss your second appointment, get in as quickly as possible, but please do not leave with one shot and believe that you are through with your vaccine at this point. The other thing we want to remind people is right now in our jurisdiction, we only have about 10% of the population that's had access to vaccine. So with that, there's still a lot of us that are susceptible to COVID-19. In fact, Colorado's estimation right now is about 1 in 115 Coloradans is currently infectious. This is still a really high rate of prevalence of disease. So we are asking you to please remember to follow the precautions that we've been following for so many months. These include wearing a face covering when you're out and about, washing your hands often, being careful about mixing households. Don't go to work if you're sick. If you're symptomatic, go in and get a test. Please continue to do all of these things. We know that we are all looking forward to getting to the end of this together, and vaccine is absolutely a step. But right now, the most important thing we can do to keep each other safe is continue to follow the precautions while we are chipping away at vaccinating the population. Thank you for sticking with this. Thank you for being a part of helping your community be safe. And as we get more information about these phases, we will continue to bring that information to you.